Great. Thank you very much, Sakina. And good morning, good evening. And we have a couple of people dialing in from the US here. And of course, we have our entire US team dialing in from Los Angeles as well. Very warm welcome to everyone. My name is Frederick Nybig. I'm the Managing Director for MedTech Innovator Asia Pacific, based here in Singapore, together with Sakina. So we have an exciting morning ahead of us. Today's theme, as you're all, I think, well aware, is in vitro diagnostics, life science tools, digital health, software as a service, and telemedicine. But I should say that it's really a broader definition than that. We also cover things like precision medicine, sensors and wearables, mobile apps, remote patient monitoring, consumer health, general wellness at this particular pitch event. So this is our online pitch event number 2. It's actually our third pitch event for this year. We had our very successful in-person pitch event in Singapore just a couple of weeks ago. And many of our judges, of course, had the opportunity to join us there. What I'd like to do is to take a few minutes, and for those of you who are not familiar with MedTech Innovator, I'll let you know who we are and what it is that we do. And then what we'll do is we'll get each of our 12 startups to give a 1-minute lightning round presentation so that our YouTube audience can get a flavor of what you all do, and for all of our judges to see each of the startups present as well. So MedTech Innovator is officially the world's largest healthcare accelerator. We're now in our 11th year in the US. We've been running the Asia Pacific program since 2019. We have across the US, Europe, and our APAC program over 500 reviewers, judges, mentors. We now have a database of more than 9,000 applicants that have startups that have applied over the years. We had well over 400 applications just for the Asia Pacific program in 2023. As of the end of 2022, we had 509 alumni companies, and we'll be well over 600 at the end of this year. 95% of those companies are still active or have been acquired, which is quite impressive. Those companies have also gone on to raise $6.5 billion in follow-on equity. There have been 36 outright acquisitions or exits, and we typically position ourselves as a later stage accelerator. So we're not a very early stage, like many of the incubators that you come across. And in fact, more than 1/3 of our applicants typically already generate revenue. This is the overview of the Asia Pacific program. So as I mentioned, more than 400 applications, and the applications came in December through to middle of February. What we've done now is, with the help of our corporate partners and our reviewers, we're selecting 50 to 60 startups, including the 12 that you will meet today, to pitch. And at the end of this series of pitch events, we'll select the 20 best companies to go onto the accelerator. 5 of those will then get selected to present at our grand finals, and 1 winner will walk away with $175,000 in completely non-dilutive cash. And there'll be multiple other awards as well, up to about the value of about $300,000. The dates, very quickly, as mentioned, the applications, this is an annual cycle. The applications were open until the end of January, middle of February. Reviewers evaluated and scored applications January through to February, and they continue to do so for the last pitch event that's coming up in May. So the period March to May is when we do our road tour. Part of that was in person with the event we did in Singapore a couple of weeks ago, and part of that is virtual, including the event that we are hosting today. So end of May is when we'll sit down with our corporate partners and identify the 20 companies that will then get selected for the accelerator. One of the things that we're doing different this year compared to previous years is we are inviting the 20 accelerator companies from Asia Pacific to join us at the annual MedTech Innovator Summit in San Francisco, middle of June. So block those dates in case you do get selected as a participant in our accelerator this year. There'll be more information, of course, coming to you as soon as we have that, as soon as that selection is made. And that's an opportunity for us to get our Asia Pacific program linked with our US program, and for our APAC cohort to meet our US cohort, as well as to meet key stakeholders in the North American ecosystem, investors as well as corporate partners. July through to September is then when we run the 3-month virtual accelerator for the 20 companies, and it is virtual, so you don't need to relocate for that. 2 key elements in that: corporate mentorship is key, and you'll, if you get selected for this, you'll have the opportunity to work with senior executives at organizations like Johnson & Johnson and Olympus and Siemens Healthineers and Teleflex and Cambridge Consultants and so on. And then we have our final showcase and grand finals, which will take place at the Asia Pacific MedTech Forum, which is hosted by APAC Med, the Asia Pacific Medical Technology Trade Association, here in Singapore, in person. And I put Q4 because the dates have shifted a little bit. Originally it was October, and then it was November. I think now it may be the first week of December, but we'll get back to you on the exact dates there. But this is an opportunity for all the 20 companies in the accelerator to fly into Singapore. We'll have a separate stage for you there where you will be able to pitch in front of the medical technology community in APAC, investors, as well as senior executives from the corporate side. So how do we evaluate the companies that present? Well, I'm not going to go through all of this, but it's a fairly rigorous process, and we'll try to be as objective here as we possibly can. We look at a number of metrics across the dimensions here of value, execution, and momentum. We look at things like value proposition, IP position, competitive advantage. We look at your team. We look at milestones that you may have accomplished, and we look at the momentum you have in terms of keeping momentum to hit your milestone. We look at client, customer, and clinical validation, and possible commercial traction, and so on. So multiple factors, and our judges, we do have a few new judges this time, but most of our judges are very familiar with the program, and I'll do the onboarding for our judges very briefly at the end of the presentation before we kick off into breakout rooms. This is just to give you a flavor of what the grand finals will look like. This was the first time that we were back in person. This was taken here in Singapore in September of 2022, where you see all of our finalists with their mock-up checks on the grand stage in front of about 1,000, 1,200 people, and those of you who will go on to the grand finals, of course, will be on that stage later this year. I wanted to extend a big thanks to our sponsors. As I think many of you are aware, we're an entirely industry-led program. We are a non-profit and therefore rely on the support, the very kind support and financial support from our corporate partners, Johnson & Johnson, Olympus, Teleflex, Cambridge Consultants, Siemens Healthineers, Enterprise Singapore, and Jabil. These are companies that you'll get to meet today in the breakout rooms. They are all on our judging panel. They will interact with each of the startups in the breakout rooms. For those of you who have access to our bio book, I think all of our startups should have that. You'll get the contact details of our corporate partners in that bio book. And you'll hear from each of these organizations during the breaks. I'll invite them up and tell you a little bit about themselves and their organization and the work that they do in the area of innovation. So a big thank you to our sponsors. Now, what I'd like to do is to introduce you to today's judging panel. And I'm not going to go through all the names here, but we have 21 or 22 judges today. The company names in bold are our corporate partners. And as you can see here, we have an interesting cross-section of the ecosystem represented here. We have investors, VCs, we have service providers, we have manufacturers, and we have academia, all represented on our judging panel. And of course, you'll be able to interact with our judges in the breakout rooms if you're a startup presenting. And you'll hear from some of these representing our corporate partners during our break. So big thank you to our judges for joining us today. And as I mentioned earlier, we'll go through the very quick orientation for the judges before we break up into breakout rooms. Now, what we'd like to do next is ask our startups to get ready to present. What we're doing is, these are the 12 companies that you will hear from today. And as you can see, we have an interesting geographical diversity here, with companies dialing in from India, from Japan, from Australia, Taiwan, even Bangladesh today, Malaysia, US, and South Korea. And you'll hear from each of these for 1 minute, because all of our judges will not have the opportunity to listen in on all 12 companies presenting. So to give the judges an opportunity to hear from all of you, and for our YouTube viewers to hear as well, what we'll do is we'll ask each of you to get ready and present. I'll invite you up, we'll share the slide, and you get 60 seconds to introduce your company, and then we'll go on to the next company. So we'll begin with Acustor, and I believe we have Amit Bhatnagar. So Amit, if you are there, you can unmute yourself and begin your presentation.
So thank you. So Acustor is a very unique and revolutionary innovation, which is lab in a box and lab on a bike, to offer healthcare service in the most remotest location of jungle, desert area, or a hilly area, by empowering the rural youth of there itself with our skilling framework. And this can offer more than 102 parameter of diagnostic, which includes complete biochemistry panel, hematology panel, CBC, urine analysis, ECG, malaria, dengue, 102 parameter of diagnostic, with doctor consultation, our teleconsultation module, and even having a primary care medicine to deliver to empower the primary health care. So nutshell, we are a unique and revolutionary solution to empower the rural healthcare to reach billions of people with most affordable and accountable quality healthcare services on ground.
Very good. Thank you so much for that, Amit. We look forward to hearing more. Next up from Japan, we have AMI, and I believe we have Tomoyo Mori presenting for AMI.
Okay, hello everyone. We are AMI from Japan. We are developing a next generation stethoscope called the Super Stethoscope. Due to the aging population, the number of heart failure patients is increasing globally, and the admission rate for heart failure is high. Our Super Stethoscope addresses this social problem and reduces the heart failure admission rate through home monitoring. Our hardware captures a wide set of heart sounds data, including human inaudible sounds, and our AI algorithm quantifies heart failure conditions using a cardiac digital biomarker. Monitoring this cardiac digital biomarker will lead to early detection of worsening heart failure and encourage early intervention by healthcare professionals. AMI provides a solution by high-quality heart failure care at home. Thank you.
Thank you so much, Morzan. Appreciate the presentation. Looking forward to hearing more. Next up, again from India, Biodesign Innovation Labs, we have Gautam Pasapuleti. We have Gautam here.
Hello, hi. I'm Gautam Pasapuleti from Biodesign Innovation Labs. We are a medical device and healthcare technology company developing rapid diagnostic solutions for detection of typhoid. The bacteria which is causing typhoid, Salmonella typhi. We have working on a specific technology which can be used for both clinical and non-clinical applications. It has an impact to help a lot of in the hospitals as well as in the community for early detection. So it is based on a specific nanotechnology application where a rapid diagnostic test device, it can be used for diagnostics for infectious pathogen, unlike a time-consuming process where in a clinical laboratory. So this test device can be used for reducing the unnecessary drug expenditure and prescriptions. And it is based on the gold nanoparticles and solutions which have changed the color from red to blue and can be used for diagnosis for pathogens and for diagnosis of typhoid. Thank you.
Great, thank you very much for that, Gautam. Next up from Australia, we have Biotone Precision Diagnostics, and I believe we have Luke Marshall here presenting.
Yeah, hi there. I'm Luke Marshall from Biotone. So for the next year, over 1 million people around the world will be diagnosed with stomach cancer. And despite treatment, more than half of them will die less than 2 years later. So at Biotone, we're creating a test for the biggest cause of these cancers, strains of Helicobacter pylori bacteria that produce carcinogenic KK protein. H. pylori is widespread, but most cases are asymptomatic. So our critical insight is to identify and treat only these KG positive infections that increase this extra cancer risk. So this reduces unnecessary treatments, cuts antimicrobial resistance risk, and greatly reduces the cost of screening. So the good news is treatment's cheap. If you knock out the infection before the cancer starts to develop, your risk returns to baseline after 5 years. We've been granted patents in different regions around the world for these markers, and this is unique. Our discovery pipeline creates targets that can be patented. Thank you.
Thank you so much, Luke. Look forward to hearing more about that. Next up from Taiwan, we have Cancer-Free Biotech. I believe we have founder and CEO Po Chen presenting.
Good morning. In
Good
today's
morning.
cancer treatment, doctor has to follow the standard protocol. It's a one-size-fits-all solution because tumor is highly differentiated from one another. In order to know whether the drug is working for a specific patient, doctor has to put it on the live patient's body. It will take as long as 3 months. Imagine in terms of time, money, and emotion that put a patient and family through. We cooperate with Taipei Medical University and develop a new approach that can put this trial and error model from live patient into lab. By collecting the patient's blood sample, we can create a tumor organoid that can act as avatar, testing as many as 100 different drugs to see which one can kill most cancer cells for the patients. We already have more, compared with the traditional organoid model, which require tumor tissue, we take advantage for liquid biopsy, much easier and complete way to collect tumor sample. We already have more than 1,000 real-world patients across 100 different types of tumor. I can wait to tell you more about our breakthrough in a breakout session. Thank you.
Thank you so much, Bo. Appreciate that. Great presentation. We'll look forward to hearing more about that as well. Next up, we have Aerognostics. And I'm pleased to say, I think this is the first time we have a company presenting from Bangladesh. So, Mutasim, if you are there, the floor is yours.
Thank you very much. Aerognostics is working to introduce molecular diagnostics and therapeutic technologies to emerging markets, beginning with Bangladesh, before we target other regions such as the broader APAC region as well as emerging markets elsewhere. Our approach is simple. We take point-of-care rapid diagnostics of multiple different kinds of technologies, with our current target technology being RT-LAMP. We compile anonymized databases of diagnostic data from these various testing services that we provide with with these technologies that we make from scratch. And the databases can then be used towards a variety of different applications, primarily the development of new therapeutics using multi-omics approaches. Our current partners are Bangladesh Sheikh Mujibur Medical University, Bangladesh's largest tertiary medical university, as well as DRRA, the Disease Rehabilitation and Research Association, one of Bangladesh's largest NGOs, and the venture is a member of the Harvard Innovation Lab.
Great. Very impressive. Thank you for that, Mutasim. Appreciate it. Next up, we have from Malaysia, Glucosense. I believe Dr. Haizan Yusof is here to present.
Hi. I'm sure everyone here knows someone who has diabetes, whether it's a family member, friend, or someone in the office. In our region, patient checks blood sugar with glucometer by pricking their finger a few times a day. It's painful, causes anxiety, resulting in many patients not doing their blood sugar testing. They are prone to high blood sugar, heart disease, and risk amputation. As a surgeon, I had done my share of amputation. We developed a solution. It's called GlucoSense, a medically certified device that can monitor blood sugar without taking any blood. You just put your finger, then you get your results. The data can be stored and digitalized, and the data management can be useful. We believe we can help many of the 500 million diabetic patients in the world, and with GlucoSense, we will change how blood sugar is monitored. Thank you.
Great, thank you very much for that. Next up, we have intelligent observation. We have Seth Freeman dialing in from the US, and thanks, Seth, for staying up late today. Over to you.
Thanks, Frederick. I appreciate it. Good morning or good evening to you. My name is Seth Friedman. I'm the founder and CEO of Intelligent Observation. Intelligent Observation reduces healthcare-acquired infections in hospitals. For those of you that might not be aware, healthcare-acquired infections are an infection that a patient acquires while they're under the care of a hospital facility. It has nothing whatsoever to do with the original reason they were admitted to the facility. These infections are costly, they're devastating, and they're extremely prevalent in hospitals worldwide. There's about 250 years worth of research that correlates hand hygiene compliance in a facility to a healthcare-acquired infection event or rate. Our company's developed a unique technology-enabled solution using a technology called near-field magnetic induction that allows an infection prevention team at a hospital to effectively monitor, understand, and manage hand hygiene compliance at the individual staff member level in real time to increase hand hygiene compliance and to reduce these healthcare-acquired infection events in their facilities. We're currently deployed at more than 100 hospital facilities in the US, and we have validated the solution significantly reduces healthcare-acquired infections and their associated costs.
Great, thank you very much for that. Looking forward to hearing more during the breakouts. Next up, we have MediSapiens from Korea, and we have Mr. Sung-Woo Kang presenting. Sung-Woo, please, over to you.
Can you hear me?
We can. Go ahead.
Yeah. MediSapiens save lives of the infants unconsciously born with a rare disease, hospitalized lying down in NICU, neonatal intensive care unit, with AI-driven genomics technology. We support medical doctors' diagnosis with our products. One is diagnostic kit, the other one is variant analysis. Key features are speedy turnaround time, minimal volume requirement of blood, and high accuracy resulted from our top-notch AI expertise. We built and successfully completed clinical validation with the SNUH, by far the best one in Korea. Due to our ESG spirit, we get heavy support from our government's public procurement. I'm currently in Washington, D.C. and Boston with the Korean president's company on our national mission to achieve Korea-US collaboration. I brought our partner hospital for joint venture. We plan to operate their NGS lab. This will bring us guaranteed revenue and act as a beachhead to extend to global market, including our key target market, Middle East. Thank you.
Great, thank you so much for that. Very interesting. We will now move on to module innovations from India. I believe we have Sachin Dubey.
Hi, good morning and good evening. My name is Sachin Dubey and I'm the co-founder of Module Innovations. So the day Sir Alexander Fleming won the Nobel Prize for penicillin, he had the fear that one day the bacteria would develop resistance. And this actually has become a huge problem with COVID, where a lot of antibiotics were misused. Now, imagine a condition when your child falls down, scratches, and gets a bacterial infection which cannot be treated. So the problem of AMR is something which, like every 15 minutes, somebody dies. 50% of the antibiotics that are used are either unnecessary or prescribed incorrectly. And by the year 2050, resistant bacteria would actually surpass cancer as the leading cause of death. This has happened because there hasn't been significant advancements in doing the antimicrobial susceptibility, and this is where Module Innovation comes in. We are building a device called as AST Sense, which is a phenotypic test that reduces the antimicrobial susceptibility testing from 3 days to as short as 2 hours. What it does, it reduces the cost of care for the patients, it reduces the length of the stay, and also improves the patient outcomes. The technology has been validated on over 3,500 patients with 6 hospitals in India, And it's based on a proprietary technology with patents granted in India, UK, and US. Looking forward. Thank you so much.
Thank you so much for that, Sachin. Very interesting. Next up, we have Redoctor from the US. We have Timur Mikhailov presenting, although I believe Mikhailov is in, or Timur is in an entirely different part of the world, dialing in. So Timur, over to you. Look forward to hearing more about this.
Yeah, thank you. So problems we're solving here are the following. Patients don't have an easy way to get their vitals without additional devices, and clinicians have to spend a lot of time to triage data and prepare a treatment plan. Our unique solution is the following. Patients can get their vitals and glucose level estimated with just a smartphone in 40 seconds, and clinicians spend less time because AI identifies trends and risks and helps them to pay attention to important cases. Moreover, it provides treatment plan recommendations. And a bit of our team, 5 out of 6 our core team members have experience from 2 to 20 plus years in life sciences and healthcare areas. And we're happy to provide you with more details during next sessions. Thank you.
Excellent. Thank you very much for that. And our final presenter for this morning is the company is Utopic Tech from India. And we have Mehul Baldwaya presenting. Mehul.
Yeah. Hi, absolute pleasure to be here. So I want to tell you about 800 million people who are living with an undiagnosed kidney disease. Our invention can help save them from years of dialysis pain and suffering by enabling early stage kidney disease screening programs. Introducing CreaSense, a device which can accurately measure creatinine within a minute from just a finger prick sample. So imagine the progress over status quo, the path labs, which take up to a day to give creatinine results and are concentrated only in urban areas and are prone to lab variations for creatinine tests. Our device is 100 times faster, portable, more affordable, and most importantly, more reliable. Thank you.
Thank you so much for that, Mehul. Appreciate it. And thank you to all our 12 companies for presenting. We are now at the point where we will give a quick orientation to our judges and then break into 6 different breakout rooms where we'll have each of our startups have 20-minute sessions with the judges. But at this point, we will, first of all, part ways with our YouTube viewers. We have been live streaming the last 30 minutes on YouTube. So thank you to our YouTube viewers for joining us. You're welcome to join us for our next pitch event, which is on the 11th of May, covering next generation surgical, orthopedics, ophthalmology, and emergency medicine. But for now, thank you to our YouTube viewers. And Sakina, you can go off live stream.